Alrighty, you can come in. Hello, how are you today?
I'm fine.
Good. My name is Whitney McDaniel, and I am an RN, and I'm going to be doing a head-to-toe assessment on you today. It's going to take approximately 20 to 25 minutes. First off, I'm going to close the door over here for privacy. So when I'm talking to you, nobody is able to hear what you're saying to me or what I'm saying back to you. How are you doing today?
I'm doing fine.
Good. Do you mind if I call you Mr. McDaniel?
It's fine.
Good. I'm going to ask you 4 questions in just a little bit. First, I'm going to let you know that I did take Mr. McDaniel's vital signs before he got in here, and they were blood pressure 137/75, pulse 75, respiration is 19, temperature 97.6, and his pulse ox was 97. Are you in any pain today, Mr. McDaniel?
No, ma'am.
Good. All right. Could you tell me your date of birth?
12/16/1990.
Could you tell me today's date?
March 6, 2020.
Okay. Could you tell me about what time of day is it?
It's nighttime.
Okay. And could you tell me where you are?
The doctor's office.
Okay. As you can see that my patient is sitting up straight and erect. He is in a pleasant mood, and he's A&O ×4. He's able to voice correctly and smoothly and have a conversation with me, and his attention span is intact. Alrighty, I'm going to say 4 simple words to test your remote memory, and I'm going to ask you to repeat them back to me. Sock, blue, bed, apple.
Sock, blue, bed, apple.
Okay, good. Throughout this exam, I will ask you those 4 words periodically. Alrighty. So first I'm going to start out assessing my patient from his head. Looking at his head, it's normal, encephalic, round. It's straight. It's sitting up on his shoulders. I don't notice any issues with his head this time. I'm going to go forward to his skin. His skin is normal, clean, brown, and intact. I don't notice any lesions, bumps, or bruises on his skin. His skin is dry. Okay. I'm also going to look at his hands and feet. You don't mind taking your shoes off. Okay. When I'm looking at his hands, I'm checking his fingernails, and I see that his fingernail is intact. They're translucent, and they're trimmed nicely. And capillary fill is less than 3 seconds. And bilateral hands. His toenails are clean and trimmed nicely. And his skin color on his feet are the same as his hands and rest of his body. His toenails are translucent, and the capillary fill is less than 3 seconds in both feet bilateral. Okay, next we're going to look at my patient's hair. My patient's hair is black, smooth, little coarse, and clean. His scalp is very clean. I don't see any flakes, bumps, lesions, bruises, or moles on his scalp. I don't see any insects in his scalp or hair, and he does have a clean cut around his whole entire head. Okay? Do you have any tenderness?
No.
Next, we're going to assess cranial nerve number 5, which is trigeminal. I'm going to ask my patient to clench his teeth. My patient does have all of his teeth and they're intact and within normal limits. Next, I'm going to check cranial nerve number 7, which is facial. Could you close your eyes and tell me where I'm touching?
Forehead, left cheek, right cheek, nose.
Okay, and could you try to open your eyes? Okay, cranial nerve number 7 is within normal limits. As well, I tested his eyes against resistance, and that's within normal limits. Next, we're going to look at his eyebrows. They're smooth, black, and a little coarse. They're both symmetrical on his face, as well as his eyebrows, eyelashes. His facial hair is smooth, a little coarse and black and intact on his face as well. He has a few tattoos noted on his chest area and 2 piercings, 1 in each ear. His ears are both symmetrical on his head. They are even with both of his eyebrows. Next, I'm going to check his ears. And I don't see any drainage or mucus. Nothing abnormal. Now see, his ears are elastic and they recoil normally. If I was looking in his ear with the otoscope, I would be looking and see a pearly gray tympanic membrane and the 3 bony bones, which is the incus, malleus, and stapes. I'm going to check cranial nerve number 8, which is vestibulocochlear. I'm going to cover one of my patient's ears, and he's going to repeat the 2-syllable word.
Basket. Rocket.
Good job. The 2-syllable words were basket and rocket, and my patient were able to recall them. Next, I'm going to check my patient's nose. Okay, could you hold your head back? Looking at my patient's nose, I don't see any mucus or abnormal drainage. I do see his mucous membranes are pink and within normal limits, and septum aligned with his nose. He has minimal hairs in his nostril area. Okay, next we're going to check cranial nerve number 1, which is olfactory, and I'm going to include 1 nostril as he tells me what he's able to smell. Close your eyes, please.
Orange.
Okay, orange, correct.
Peppermint.
Peppermint, correct. Cranial nerve number 1 is intact. Next, I'm going to check my patient's eyes. We're going to check cranial nerve number 2, which is the optic nerve. I would have a Snellen eye chart 20 feet away from my patient, and I would have him to read the chart to me without glasses and contacts if my patient wore them initially. And then I would have him to put the glasses and contacts on to read the chart. First, I would cover one eye without glasses and contacts and let him read the chart. And then second, I would cover the second eye and have him to read the chart without glasses and contacts. Next, I'm going to check cranial nerve 3, 6, and 4, oculomotor, trochlear, and abducens. I'm going to dim the lights to check pupil constriction as well. Okay. My patient pupils do constrict to light. His pupils are round and black, and his eyes are brown. Sclera is white, and mucous membrane is pink, moist, and intact. Alrighty, I'm gonna ask you to follow my pen light. Okay, good job. There's no extraocular movement from my patient's eyes. That is intact as well. And if I was testing the red eye reflex, then I would have an ophthalmoscope standing 20 feet away from my patient with a light shining, and that is normal in my patient at this time. Next, I'm going to go and assess my patient's mouth. Okay, then I have my patient to open his mouth and say, ah. Okay, as I'm looking to my patient's mouth, I can see the remaining of his teeth in the back and at the top, and he does have a few fillings in his mouth. At the top, I do see the hard palate, which is white with translucent and minimal rugae, and his soft palate is present as well, and it's pink and moist. His tongue is normal, moist, and pink. Okay. I'm going to put this tongue depressor in so that I can see your tonsils. Okay, and he does have tonsils in the back, and they're +2. And his cranial nerve 9 and 10 is intact because his uvula rises and falls. We're going to check the hypoglossal cranial nerve number 12. Could you stick your tongue out, please? Move it from side to side. Okay, good job. Okay. Next, we're going to move down to my patient neck, and we're going to assess his carotid arteries separately. And then we're going to listen. Both of his carotid arteries are equal, strong, and intact. And if I was listening for a bruit, then I would know that he have a narrow artery. And my patient does not have that. I don't hear a bruit at this time. Next, we're going to look at my patient's skin on his neck. It's the same color as the skin and the rest of his body. It's brown, clean, dry, and intact. There's no bumps, bruises. Do you have any crepitus? Okay, don't feel any crepitus, no pain or tenderness. Okay, we're going to check cranial nerve number 11, which is the accessory. Could you shrug your shoulders against my resistance? Good. Cranial nerve 11 is intact. Next, we're going to, you can turn this way. Check my patient's, this way. Lymph nodes. To start out with is the preauricular, which is here at the front. Go back to posterior auricular, occipital back here. His tonsillar under, submandibular here, submental under here in his chin, the superficial cervical right in here, and the deep cervical area right in here, and his supraclavicular right in front of that clavicle. You can turn Did you have any tenderness?
No.
Okay, no tenderness or pain noted, which is good. Next, we're going to assess my patient's lungs. I'm gonna check him for equal chest rise and fall as I'm looking. His chest is equally rising and falling. There's no issues noted in that area. Okay, turn this way slightly. I'm gonna check my patient for any crepitus, tenderness, or pain. Do you have any?
No.
Good. Next, I'm going to percuss, and I'm going to have my patient to say the number 99 continuously.
99, 99, 99, 99, 99, 99.
All right. I don't notice any primitives during the percussive, and I did notice vibration, which is normal for my patient. On the chest expansion for my patient, you can take a deep breath. Good job. My patient chest does expand normally, and within normal limits, my hands does move out as my patient takes a deep breath. Next, I'm going to listen to my patient lungs. First, posterior. And just breathe normal. My patient has normal vesicular lung sounds posteriorly. Now I'm going to have my patient to turn towards me so that I can assess lung sounds laterally. My patient has normal vesicular lung sounds laterally. Now I will assess anterior. My patient's lung sounds are normal vesicular lung sounds noted anteriorly. Even breath and oxygen exchange. No flail chest. No crepitus noted. At this time, I'm going to ask my patient, did he remember those 4 words that we went over at the beginning of the assessment?
Sock, blue, lead, apple.
Good. So his remote memory is still intact. Next, we're going to talk about breast exams. They're very important to do, not only in females, but males as well. There's 3 different ways that you can do a breast exam, and that's with your arm over your head, leaning forward, and with both of your hands on your hips, okay? When you're looking and assessing your breast tissue, you're looking for any striae, abnormal lines, abnormal veins, masses, bruising, tenderness when you're palpating, any dippling of your nipple. Your nipple should be darker than your breast, and they should be everted. You should not have dimpling in your nipples. You can make sure you do axillary checks underneath your arms, and that's lateral, central, and posterior and exterior. In the motion that you're checking your breast, you need to check in the wheel area motion, circular motion, and you can do vertical strokes as well. Also remember to pinch your nipples to ensure that there is no abnormal discharge that's coming out as well. And you need to report that to your provider. That's all I have about breast exams. I'm going to ask you one more time. Do you remember those 4 words?
Sock, glue, bed.
All right. Well, thank you, Mr. McDaniel, for participating today. And that's it. End of my video.